Hello, everyone. You're listening to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Ben Ashby, the head of optometry at Specsavers. Today, we're going to talk about why Australians should prioritize their eye health, and also Ben is going to talk about some research that his organization has done regarding eye health. Without any further ado, welcome to the show, Ben. It's so nice to have you here.
Thank you very much for having me.
My pleasure. So, Ben, please tell the audience more about yourself and your organization.
My role is to support Specsavers optometrists to improve and protect the sight of all Australians. So this means correcting vision either with glasses or contact lenses and detecting avoidable causes of blindness so that treatment can be commenced early.
That's very fascinating to know. So, Ben, can you tell us why so many Australians are failing to undergo eye tests every 2 years?
Yeah, there's a number of reasons. I think number one, and certainly the research supports this, is awareness. Many people think that if they're not experiencing a problem, then there isn't a problem with their eyes. But we know that most eye diseases, you don't notice them in the early stages, and this is the time when it's most important to actually start treatment so that hopefully it never goes on to affect your vision.
So what kind of eye conditions are not detectable in the early stages?
Well, we can detect them in the early stages, but they don't have any symptoms, unfortunately. So the big ones there, we're talking about glaucoma, macular degeneration, and diabetic eye disease. And of these conditions, quite sadly, there are 300,000 Australians that have lost vision to them. And yet these are conditions that if they were picked up early, treatment probably could have saved their sight.
Yes, it does sound very sad indeed. So what is the reason why more and more Australians are getting these kind of eye diseases?
Certainly aging population is a significant contributor to that. These are diseases that affect you more as you're getting older, which is a worrying element of this research that we've just committed, because we've found that of those aged over 40, 2 out of 3 are having a problem with their sight, but they're not doing anything about it. And this is putting their vision at risk. The good news, though, is that 90% of vision loss is avoidable or treatable. But then it gets worrying again when 50% of those people over 40 don't get their eyes checked regularly. And in this age group, we do know there's about 25% that do have an eye disease that we could be actively working towards preventing.
I see. So can you tell us, Ben, why is it important for Australians to make sure that they undergo eye tests regularly?
It's really important to get regular eye tests because most of the most serious and common forms of vision loss are correctable and that we can pick them up before you have any symptoms whatsoever. So, for example, glaucoma affects 300,000 Australians. Sadly, 150,000 of them aren't diagnosed yet, and there are no symptoms in the earlier stages. But treatment is as simple as an eye drop per day if it is picked up, and that can preserve your sight for the rest of your life.
Well, it's a good thing to know, Ben, that these types of eye diseases can be treatable, especially during the early stages.
It certainly is, yep. But we just need to make sure that more Australians actively look after their eyes. So in Australia, we're very good at doing things like attending screenings for cancer, first sign of any problems with our heart, and we see our GP straight away, but we just don't prioritise our eye health in the same way. And yet everyone considers their vision to be so precious, but we don't actively look after it. And really, we should be getting our eyes checked at least every 2 years.
That's true, Ben. I agree with you. A lot of people are worried about cancer. They're worried about their heart health, their bowel health, but people claim that their eyes are the most precious part of their body, but we don't really take care of it. So why do you think people neglect to take care of their eyes or get their eyes checked?
Sometimes it's time, sometimes it's cost, sometimes it's just that idea that if I had a problem, I'd know about it. But the research shows time and time again that picking these things up early isn't something you can wait until you've actually got a symptom. You've got to engage in proactively getting your eyes checked on a regular basis.
Absolutely. I agree with you. So what advice can you give to our listeners regarding their eye health?
First thing, if you haven't recently had an eye test, book in and get your eyes checked by an optometrist. Next thing is to commit to regular eye testing. And the other really important thing is that if you have an eye condition yourself, you need to tell your relatives about it to make sure they're getting their eyes checked, because so many of these treatable and avoidable eye conditions have quite a strong genetic component. In fact, up to a 50% chance of having another relative with the same condition.
Fantastic advice. Thank you so much, Ben. Now, if you don't mind, can I ask you a personal question?
Absolutely.
Why are you so passionate about helping people with eye conditions? And by the way, how did you get into this specific medical field in the first place?
I'm so passionate about it because there really, for me, couldn't be anything more rewarding than helping people on a daily basis to see the world more clearly and then to actually save people from losing their sight. So I ended up in this role because I always wanted to be a healthcare practitioner, and I just ended up focusing on eyes, and it's been an incredibly rewarding career.
That's fantastic to know that someone like you is so passionate about helping people, especially when it comes to their health.
There's such an opportunity to make a difference out there.
Yes. But before we go, can you please tell our audience, for those who want to get in contact with you, how can they do that?
They can do it very easily. Specsavers is the largest provider of eye health services in Australia. We see over 3 million patients a year. We have practices in every location across the country. We're accessible, affordable, we have the latest technology, and we bulk bill all of our consultations. So they simply have to either go online or call up to make an appointment at Specsavers.
That's wonderful. Thank you so much, Ben, for coming on the show. It was fantastic having you.
It was a delight to talk to you.
And that was Ben Ashby, Head of Optometry at Specsavers. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moretto, and you're listening to Health Professional Radio.